Questions without notice. Are there questions without notice? The Leader.
Thank you. Thanks, Mr Speaker. My question is to the Premier. Has the Premier formally advised His Excellency, the Governor, the Honourable Hugh Van Lay, that his party no longer controls a majority in the House of Assembly?
The Premier.
Thank you very much, sir, and I thank the Leader of the Opposition for his question. I have spoken to His Excellency about the changed arrangements with regards to the size of our joint party room, yes.
The Leader.
Thank you, Mr Speaker. My question is to the Premier. Was the Premier unable to get the support of his own party room last night for his proposed changes to the Emergency Management Act?
The Premier.
Well, we certainly don't canvass issues in our joint party room here in the Parliament. But all I can say is that we had a full agenda last night. We had a comprehensive program which consisted of bringing forward policies and legislation here in the Parliament.
The Leader.
Mr Speaker, my question is to the Premier. Have any members of the Premier's backbench reserved their rights to not support the government's proposed changes to the Emergency Management Act?
The Premier.
We don't discuss those matters in this Parliament.
Order. The Leader.
Thank you, Mr Speaker. My question is to the Premier. Has the Premier now lost control of the Liberal Party room as well as control of the House of Assembly?
The Premier.
Well, sir, I find this line of questioning from the Leader of the Opposition intriguing and instructive, because it, I think, perfectly demonstrates what those opposite are interested in: politics and games. Let me tell you, sir, what we're focused on this side of the House, and that is delivering for the people of South Australia. The people of South Australia elected a majority Liberal reformist government to fix the mess of 16 years of destruction that the previous government wrought on the people of our state. The simple fact is they elected a government to deliver more jobs, lower costs and better services. And that is precisely what we are focused on here in South Australia.
The Leader will cease interjecting.
When we look at the most recent APS job statistics, we see South Australia doing well compared to just about any other place in the world. Now, those opposite hate this. They absolutely hate it. They hate
Order. The Leader.
They are barracking for South Australia to fail, but South Australia will not fail. South Australia is united. Not only are we united, sir, in our focus, united with the people of South Australia to take on this coronavirus from a health perspective, but also, most importantly, from an economic perspective. And that's where the partnership has come from, sir, focused on keeping our state healthy, but also keeping our economy strong and getting as many people back into employment as we possibly can. That is our focus. Now, we know those opposite have other areas that they focus on: games, intrigue, all sorts of political games.
Not office management.
Not us. We're focused unequivocally on delivering for the people of South Australia. We're all elected, every single member in this chamber, all 47 members, sir, were elected by their constituents to represent their interests here in this Parliament. And we are charged with the responsibility every day considering their interests. Well, their interests are about South Australia doing well with the coronavirus, making sure that we remain safe. We've done well to date. There is no doubt about that whatsoever, but there will be some challenges this year as well, especially around the vaccination program. But we expect that cooperation, that partnership, that united focus that we've had in South Australia in the first part of the coronavirus, dealing with making sure that we get our testing up, our QR code adherence up in South Australia. We expect that cooperation will continue into the future. That's what the people of South Australia are focused on, and that's certainly what our government is focused on.
Before I call the Leader, I call to order the member for Playford. I call to order the member for Lee. I call to order the member for West Torrens. And I call to order the leader.
Thank you, Mr Speaker. My question is again to the Premier. Does the Premier consider his changes to the Emergency Management Act are draconian? And with your leave, Mr Speaker, and that of the House, I'll explain.
Leave is sought. Is leave granted? Yes, sir. Leave's granted. The leader.
5AA presenter David Penberthy this morning said that sources inside the Liberal Party room had told him there were tense exchanges about a proposal that was brought forward by the Attorney-General for an extension of an emergency powers.
The leader has the call.
Quoting Mr Penberthy, quote, "It's been put to me that the extension that is being proposed is more open-ended, and one source described it as even being draconian and handing too much power to the state."
The Premier.
Now, Mr Speaker, I thank the Leader of the Opposition for this question. Now, I was chairing the Joint Party room yesterday and I was pretty observant as to who was in the room. David Penberthy was not in the room. He has not been elected, and we don't have people that are not elected in that room. So David Penberthy was not in the Joint Party room yesterday. It is true that we consider making sure that we have got the very best legislation, regulation around emergency management. I think South Australia has done extraordinarily well in terms of managing the global pandemic so far. It is an interesting situation that we have at the moment because our Emergency Management Act in South Australia, sir, generally relates to a very short emergency, usually, for example, with something like a bushfire. Now, this has now been an extended period of time, and we have had some temporary arrangements in place, and we will continue to consider whether some of those need to be incorporated on a longer-term basis. And we'll do that in consultation with the Joint Party room, and ultimately we will bring government policy, back to this House for their consideration. Ultimately, for that to prevail, we need to have successful votes in this House and Legislative Council, and then, of course, according to the way that we govern in South Australia, that ultimately goes to His Excellency, the Governor of South Australia, the Honourable Hugh Van Lay AC, and he may choose to assent to that bill and bring it into law.
Member for Flinders.
Thank you, sir. My question is to the Premier. Can the Premier please update the House on how the Marshall Liberal government is building confidence in our state, particularly in light of the recent Infrastructure Australia priorities list?
The Premier.
Very much, sir, I can, and I thank the member for Flinders for his excellent question, which is really focused on two things. One is the confidence levels in South Australia, and two, the Infrastructure Australia priority list, and they go hand in glove, sir, and very, very well indeed. Can I just say, recently we've just had another confidence survey which has been released, this time the Bank SA State Monitor. The results for February business confidence reached the highest level since, are you ready for this, 2005. Last time I looked, that was quite some time ago. The reality is business confidence is very high and it's surging. And this is completely and utterly at odds with what most people would have expected would have been happening right around this time. We are dealing with a very difficult pandemic at the moment. This has made many people feel anxious and concerned about the future. But because of the way that the pandemic has been handled here in South Australia, people are actually feeling more confident. Business confidence is up. Consumer confidence is up even further. Business confidence, consumer confidence, sir, surged 9.2% up to 124.9 points. This is the highest level in more than a decade. High business confidence, high consumer confidence, high investor confidence in South Australia. And that is going to continue into the future because the people of South Australia know that they've got a government which is focused on delivering for them. Sir, the member in his question also referenced the Infrastructure Australia priority list. Now, can I tell you, we had 6 projects which were listed as high priority or priorities. This is the largest number of new proposals for South Australia in the list's 5-year history. The highest level since this list was created, 6 new projects for our state, and this will give great confidence to those people in the business community in South Australia. The initiatives identified are consistent with Infrastructure SA's 20-year state infrastructure strategy, which highlights, I think, the value of Infrastructure SA, an election commitment that we took to the 2014 election, the 2018 election, and that we have now implemented here in South Australia. We were the last jurisdiction, sir, to actually develop an infrastructure body in South Australia. It was a shameful situation. It was done at the national level. It was done in every other jurisdiction. Ultimately, it's here in South Australia now and delivering for our state. The 2 high-priority initiatives are really important for our state. The first is the Adelaide Outer Ring Route Capacity Initiative, which will build what matters on our outer ring by improving safety and also travel times. And the second one, sir, is the South Australian Road Network Initiative's aim to reduce the increasing backlog of road maintenance on roads throughout the state, which was estimated to be more than $750 million back in 2019. These projects, together with the other projects, will build on the $16.7 billion worth of infrastructure investment that is currently in train. It was announced in our budget last year. I know many members are feeling very positive about that, but most importantly what we're seeing is business confidence sky high. That's flowing through to consumer confidence. So despite every single issue that has been thrown at South Australia in the last couple of years, whether it be dry or drought conditions for our farmers, whether it would be devastating bushfires on Kangaroo Island, Adelaide Hills, down in the south-east, over on the Eyre Peninsula or on the York Peninsula, or the coronavirus, we've been able to stand up, deliver for the people of South Australia and provide them with a government which is inspiring their confidence.
Order. Before I call the member for Ghana, I call to order the member for Chafee. Call to order the member for Cheltenham. Call to order the member for Hurdle Vale. I warn the member for Lee and the member for West Torrens. Member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. Does the Premier believe the government has met its own target to end ambulance ramping in the Central Adelaide LHN by the 30th of April 2020? And with your leave, sir, and that of the House, I'll explain.
Leave is sought. Is leave granted? Leave is granted. The member for Ghana.
It was announced by the government that the Central Adelaide Local Health Network would end ramping by April last year. The bulletin titled "Ramping is not right, it ends on April 30" was issued in March last year. The spokesperson said to the advertiser at the time, "We are seriously committed to stopping ramping by 30th of April 2020.
The Premier.
Thank you very much, sir, and I thank the member for his question. It is a very important question, and we have stated publicly on numerous occasions recently that the current level of ramping is unacceptable and needs to change. And that's exactly and precisely what we're doing in South Australia. We're putting very significant additional investments into the current system to make sure that we can improve this situation. And this comes in various areas. First of all, of course, the upgrading of various emergency departments right across South Australia. When we came to government, of course, we had a very difficult situation that we inherited from those opposites, sir.
Order. The leader will cease interjecting.
Emergency departments right across metropolitan Adelaide. More than downgrading emergency departments, actually closed the repat. So they were putting massive additional pressure. What we now currently have on the books.
Order. The Premier resume his seat. Order. The Premier resume his seat for a moment. Interjections on my right and interjections on my left will cease. I'm doing my best to listen to the Premier's answer. The Premier is entitled to be heard in silence. The Premier has the call. The Premier.
So I was just talking about the massive upgrade in terms of the emergency department capability and capacity that we are embarking upon at the moment in South Australia. Now, this project, which is very significant for our state, is causing some additional capacity constraints, particularly in the southern system, which flows through to the central system, because at the moment the Flinders Medical Centre, which is the busiest emergency department in South Australia, needs a massive expansion. That is underway at the moment, but there is actually a reduction in beds available during this construction. But what will ultimately be delivered, sir, is the largest emergency department in the state. We're doing an upgrade to Modbury. we're doing a massive expansion out at the Lyell McEwen Hospital at the moment. In fact, we're completely rebuilding the emergency department at the Queen Elizabeth Hospital. There are projects now in excess of $100 million worth of upgrades and capacity increases for our emergency departments in South Australia. We're also looking very closely at the patient flow through our hospitals, which is one of the issues which is causing some problems, making sure that people are in the right beds. If they need to move into alternative care, whether that be aged care or some other facility, sir, we're doing what we can to do that. There are a range of options that we're also considering. Thank you very much, sir.
Order. Before I call the member for Ghana. Order. 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 Before I call the member for Ghana, I call to order and warn the Minister for Education. I warn for a second time the member for West Torrens. I warn the member for Playford. The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. Premier, is it correct that the ramping hours of December 2020 were more than double those of December 2017 before you were elected? And with your leave, sir, and the House, I'll explain.
Leave is sought. Is leave granted? Yes, sir. Leave is granted. The member for Ghana. Order.
In December 2017, before the last election, there were 661 hours of ambulances ramped. In the most recent figures released, December 2020, there were 1,361, more than double the previous rate.
The Minister for Education.
Thank you, sir. It's a pleasure to be able to take this question on behalf of the Minister for Health in the other place. Many things have, of course, changed since December 2017. In the Health Department in particular, there have been many benefits to the people of South Australia as a result of the election of the Marshall Liberal government since 2017. Coming into government, of course, confronted with the devastation left by those who imposed transforming health on our state, the Transforming Health Advisor, the member for Ghana, of course, the Transforming Health Treasurer, the member for West Torrens, and the Transforming Health Minister, the Leader of the Opposition, left the people of South Australia with a series of circumstances from which this government has worked hard to improve our situation.
Order.
We have identified, as the Premier just said, that ramping, sir, is unacceptable, and we are working very hard to improve it. Correct. There is indeed a comprehensive plan that is being undertaken by the Department for Health to improve this. It covers issues like beds, like patient flow, like alternative treatments, ambulances, the delivery, of course, of an urgent mental health care facility in Adelaide, upgrades to the Lyell McEwen emergency departments, upgrade to the Modbury Hospital emergency department, a brand new emergency department at the Queen Elizabeth Hospital, and a significant, massive upgrade at Flinders Medical Centre. All of which dramatically will enhance the capacity of the Health Department to deal with supporting the needs of the people of South Australia, including reducing ramping. Of course, there is a complexity that comes out of the massive upgrade at Flinders. There is a complexity that comes out of the massive upgrade at the Flinders Medical Centre.
Order. The Leader will cease interjecting. The Minister for Education has the call. He is entitled to be heard in silence. The Minister for Education.
I'm grateful for the pause, sir, because it's important to note that this massive upgrade to the Flinders Medical Centre was not proposed or undertaken by the Labor Party when in government. They were busy closing hospitals. They closed the repat, you'll recall. They dramatically downgraded the South Australian health system. While the Leader of the Opposition was the Minister for Health in the former government, while the member for West Torrens was the Treasurer for Transforming Health, while the Shadow Minister for Health was the Advisor for Transforming Health, they downgraded South Australia's health system. We are fixing it. We have a comprehensive plan, sir, to deal with the ramping issues. Since coming to government, since the December 2017 date that the Shadow Minister for Health identified, we have massively increased, significant increases to the budget of SA ambulances. We have refreshed the fleet, and we have, of course, sir, put a large number of additional paramedics and ambulance officers into the system.
Order.
Now, sir, the South Australian Health Department is dealing with a range of challenges across South Australia, of course, because there is a global pandemic that has devastated health systems around the world, that has put our health system around Australia under pressure, that has caused changes to practices and indeed has had impact on a range of things. And despite that, we have extraordinarily strong health outcomes in South Australia compared to any other state, compared to any other jurisdiction in the world. There are challenges as we fix the health system left to us by those opposite. The South Australian Health Department, the Minister for Health, are doing terrific work. They have a comprehensive plan which we are delivering on, and I, sir, am confident that the people of South Australia understand what is improving and understand the hypocrisy of those who seek to talk it down.
Before I call the member for Ghana, I call to order the member for Hammond. I warn the member for Chafee. I warn the member for Cheltenham. I call to order the member for Light. I call to order the member for Colton. I warn for a second time the member for Playford. The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. Has the Premier spoken to any paramedics about their current concerns regarding ambulance resourcing, and if so, what was the Premier told?
The Premier.
Well, in fact, I actually had an opportunity while I was out with the member for Newland, actually on the weekend. We were out in his electorate and I did meet some paramedics. They didn't raise concerns with regards to the issues that are raised by the member. In fact, they said that they were very much enjoying working within SA Health. In fact, it was a couple who had moved here from overseas. And look, there are issues that are associated with ramping at the moment. We're not sweeping this problem under the carpet. In fact, we're taking it head on with a comprehensive program. But this is a problem from an entire systems perspective, and so there are many things which need to be done to correct the situation which we currently are experiencing here in South Australia, sir. One of those things was announced today. In fact, where we are, if you like, expanding the mental health co-respondence program, which started as a pilot in the Central Adelaide Local Health Network and is now going to go across other local health networks in South Australia. As the Minister for Education updated the House only a few moments ago, the Urgent Mental Health Care Centre, which was proposed last year in response to if you like, very high-level presentations, mental health patients at the Royal Adelaide Hospital experiencing delays. We went out to the market. We have now resourced that project, and that will be opened in the coming days. There are many things which need to be done to fix the mess that we inherited from those opposite. Part of it is capital upgrades. Part of it are new programs that divert patients from our emergency departments and put them into alternative care which is more appropriate. Some of it is patient flow through the hospitals and of course some of it is to do with the ambulances, and that's why I think we feel very proud on this side that we have had some very significant upgrades to our ambulances, the physical ambulances in South Australia since coming to government. We've also put more money into the South Australian Ambulance Service budget and have had a very significant increase in the number of personnel who are in there. But there is still much, much more work to be done, and that's precisely what we're focused on.
Member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. Does the Premier agree with the Chief Executive of SA Ambulance, David Place, that the service is going, quote, backwards, is simply, quote, treading water, and is only, quote, getting harder? And with your leave, sir, and the House, I'll explain.
Order. Order. Members on my right. Leave is sought. Is leave granted? Leave's granted. The member for Ghana. Last
week on ABC 891 Radio, SA Ambulance Service Chief Executive David Place was asked if resourcing was going backwards, and he said, quote, yes, treading water is as best as you could put it. When asked if the situation was deteriorating, he said, quote, yes, it is getting harder.
The Premier.
Thank you very much, sir. I didn't hear that interview in the context in which it was stated, but as I've just updated the House, we've very significantly increased the resources, both financial and physical resources, to the South Australian Ambulance Service since we've come to government. We are in a negotiation period at the moment for the new enterprise bargain agreement. We are listening to what the South Australian Ambulance Service is putting forward. We know that they do an outstanding job for our state. We know that they work very hard, and we know that the current situation with regards to ramping is unacceptable in South Australia. But there is not one simple solution to the current situation that we inherited from those opposite on coming to government. There's a program, a comprehensive program, that is being implemented. If it was just one simple thing that needed to be changed, it would have already been done. But the reality is there is much work to be done. At the moment, there is a very, very large capital project, sir, well in excess of $1 billion going across our hospitals, both metropolitan and country at the moment, and more than $100 million of that is going into the capacity increases and the capability upgrades within our emergency departments in South Australia.
The member for Elder.
Thank you. My question is to the Minister for Trade and Investment. Can the Minister update the House on how the Marshall Liberal Government will grow confidence within the construction industry in the state through the record pipeline of current and future projects?
The Minister.
I'll take that question there, sir. And what I can say is that the hills are alive with the sound of confidence. In fact, so are the plains and so are the regions. And that's because the community knows that our state is getting back on track. After 16 years of rot from those opposite, our $16.7 billion infrastructure spend is far greater than what they would have ever seen on that side of the House.
Resume his seat. The Minister resume his seat. Interjections on my left will cease. The member for West Torrens will leave for 20 minutes in accordance with Standing Order 137, capital A. I call to order the member for Elizabeth. I remind members that the Minister, in answering the question, is entitled to be heard in silence. The Minister has the call. The Minister.
Thank you, sir. I know those opposite don't like to know about the confidence that is being built in the construction industry. It is outstanding and they are appreciative of the work we're doing. We are building, as I said, $16.7 billion worth of infrastructure over the next 4 years. That's hospitals, it's schools, it's sporting infrastructure, it's road infrastructure, it's public transport infrastructure. Hospitals, as I said, and also water infrastructure we are delivering for the people of South Australia. And that is supporting local businesses and it is growing jobs in South Australia. More than 19,000 jobs in that pipeline, which has confidence sky high, Mr Speaker. One of the great projects, I was out with the Premier just the other day and the Minister before me did a marvellous job in getting this one off the ground, and that is the Regency to Pym project. We were out having a look and speaking to the workers on the ground and the confidence that has been instilled in that sector by delivering this project. And guess what? Guess what? It's ahead of schedule, and guess what? It's under budget. A great project being delivered by this government, which means we can invest in more projects here in South Australia.
Order.
We are doing the job
Premier.
and we are reaping the rewards, Mr Speaker, and that will be open in the coming months, and the South Australian commuters will reap the rewards when they get to save time, travel time, up to 8 minutes in peak hours as they have their daily commute reduced, Mr Speaker, so they can get home earlier and spend more time with their families, and that's what we're going to be delivering for the people of South Australia. Of course, this funding secured through the 2018 budget in partnership with the federal government, and some of the partnerships with the federal government have been outstanding for this state, and that's where this confidence is growing, Mr Speaker. The Deputy Prime Minister was here just last week, of course, announcing $100 million for Tranche 1 of our road safety program. And this is a great program. If you've been out into our regions over the past couple of months, and those opposite probably haven't, but on this side I know we have, and when you see some of the roads and the work that is happening in our regions, Mr Speaker, it is delivering confidence again. Let me run through some of the roads and the projects that are underway. The Barrier Highway, Todd Highway, Birdseye Highway, the Horrocks Highway, Augusta Highway, Eyre Highway, Riddock Highway, Narkett Highway, Stewart Highway, Millenton Road, Upper York Road and the Karoonda Highway as well, Mr Speaker. All these projects improving safety, delivering jobs for South Australia and increasing confidence, filling the industry with confidence here in South Australia. So when we came to government, of course, the cupboard was bare. The cupboard was bare because they hadn't done the planning work over that side. A very poor government. 16 years, no projects on the go. Now we've got them rolling out the door, Mr Speaker, and as we saw, 6 new initiatives onto the Infrastructure Australia priority list. 6 new, more than have ever gone on there before under the previous government. They did nothing, sat on their hands, and we are rolling them out. High productivity vehicle network, Mr Speaker, a very important project rolling out, as the Premier mentioned, our outer ring route, a high priority list, and clearing that road maintenance backlog. Boy, they left us a job there. We're tackling it, but we've got more to do. And the feds have identified this as well, and they're going to work with us. And, of course, removing level crossings as well. Very key projects. Very key projects that they didn't deliver. But we are getting on with them. We'll be doing more of them as well, Mr Speaker, working with the feds to deliver those projects. So for decades, our roads neglected by those opposite, but we have got these projects on the IA list. We are working with the federal government to deliver more, and that is what's putting confidence back into the sector across South Australia. More jobs, lower costs, better services, and building what matters for South Australia.
Yeah. Order. Before I call the member for Ghana. Order. Before I call the member for Ghana, I call to order the member for Raynell. I call to order the member for Ramsey. I warn for a second time the member for Lee. The member for Playford can leave for 20 minutes in accordance with Standing Order 137A. And I call to order the Premier. The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. Why does the government's own budget papers reveal that this government is cutting funding to the SA Ambulance Service budget? With your leave, sir, and that of the House, I'll explain.
Leave is sought. Is leave granted?
Yes, sir.
Leave is granted. The member for Ghana.
Thank you. The government's own budget papers show SA Ambulance funding has declined by $23 million in 2 years. In 2018-19, it was $208.1 million. In 2019-20, it was down to $195 million. And in the last year's state budget, it was down to $184.5 million, a reduction of $23.6 million in operating funding in just 2 years.
Wow.
The Minister for Education.
Yeah, look, thank you very much, Mr Speaker. I'm grateful for the opportunity to take this question on behalf of the Minister for Health. Obviously, the member is aware he was part of a cabinet for a brief period of time under the former government. He's aware of the way that
Order.
the Treasury papers
Order.
work in relation to a
Minister
budget.
has the call.
If he's struggling to remember, he can ask the member for West Torrens, who I think was Treasurer at the time and set in place a certain set of figures. And indeed, since coming to government, this government has indeed invested further funds in ambulances, has supported the refreshing of the fleet, has indeed ensured extra paramedics. And as we talked about before in the Premier's earlier answer and in my earlier answer, we have spent, sir, the last 2 years and 11 months working every day to enhance the position of the people of South Australia, to repair the degradation on the health system and the ambulance system left by those opposite, and indeed to restore the South Australian public's confidence in a health system that the member for West Torrens as the Treasurer,
Member for Lee will cease interjecting.
Croydon as the Health Minister, and the member for Ghana as the Senior Advisor, Chief of Staff, I think,
Leader will
to
cease
the Minister
interjecting.
for Transforming Health, left in such a state of disrepair, left in a state where nobody in South Australia had any confidence in their capacity to deliver the health services that the people of South Australia expected, deserved and desired. Now, the Minister for Health, the entirety of the SA Health workforce, the Health Department across South Australia has worked very hard over the last several years. We've been confronted, of course, with the most significant pandemic to confront our nation or the world in 100 years, and they are working hard every day to pass the test that is expected of them by the people of South Australia to deliver great services. We have a comprehensive plan, as we identified before, to enhance the capacity and to enhance the practice that is delivering for the people of South Australia, that will seek to reduce ramping, that when I think the enhanced emergency departments at Lyle McEwen and Modbury, when the enhanced emergency department, the brand new emergency department at the QEH...
Order. The member for Lee rises on a point of order. The member for Lee.
Standing Order 98, Sir. Debate. The question was very specific about why there's been a $23 million budget cut to the South Australian Ambulance Service.
Order. Does the minister rise on the point of order?
I'll wait and see your ruling, sir.
I have the point of order. I'll deal with the point of order, Minister for Education. The question referred to budgets, allocations in successive years. The minister is addressing the question. The minister has the call. The Minister for Education.
Thank you, sir. The government will continue its strong investments in the South Australian Ambulance Services, its strong investments in improved emergency departments, which of course have a direct correlation with the impacts of the issue that the member is asking about. That's why we're improving the emergency department at the Lyle McEwen. It's why we're improving services at Modbury Hospital, so that residents in the North East can have that improvement. It's why we're delivering a massive, massive upgrade to the emergency department at the Flinders Medical Centre, an upgrade that is currently underway, that is impacting indeed on capacity right now, but when complete, we'll see a dramatic improvement.
Member for Lee.
An upgrade that, if it had been invented by those opposite when they were in government, we wouldn't need to be doing this work now, and we wouldn't be confronted by that problem now. But, sir, for 16 years, those opposite were in government. For 16 years, they failed the people of South Australia. They left us with a mess. We're getting on with fixing it, sir.
Order. Before I call the member for Ghana, I warn for a second time the leader. The member for Lee can leave for 20 minutes in accordance with Standing Order 137 A. The member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. Premier, why were there 112 fewer nurses working in our health system as of the 30th of June 2020 compared to the 30th of June 2019?
The Minister for Education.
Sir, the member is obviously not putting an explanation to that question because he knows that there's a lack of confidence, I think, that the House has in his numbers as a general view. What the House does know is that since coming to government, this government has indeed refunded dramatic enhancements to the health budget compared to the settings left by the member for West Torrens when he ceased to be the Treasurer of South Australia just 3 short years ago. Just 3 short years ago, when we were denied that opportunity to have the settings left by the member for West Torrens as the Treasurer continuing in the budget. Now, this government has restored funding to the health services. We continue to restore confidence in the health services, and we'll continue that work. The increased support for the health services in South Australia has run into the hundreds of millions of dollars, and we are delivering better outcomes for the people of South Australia.
The member for Ghana.
Thank you, Mr Speaker. My question is to the Premier. Has the government boosted the ambulance service by even one single additional crew over its entire time in government? And with your leave, sir, and though the House, I explain.
Leave is sought. Is leave granted? Yes, sir. Leave is granted. The member for Ghana.
Thank you, sir. In December 2017, the previous government, under the previous minister, committed funding for another 112 extra paramedics in the system. The Premier has repeatedly claimed that their government has boosted paramedic workforce. Yet yesterday, the Ambulance Employees Association responded to those comments with the following, quote, "There have been no additional ambulances deployed under the Marshall government. Despite government claims, the last additional ambulances were deployed over 3 years ago, back in 2018, funded by the previous government. The only staff hired since then have replaced ambos leaving the service and topped up additional rosters."
The Minister for Education.
Sir, I thank the member for the question. He continues to talk about things that were described in 2017 in December by the former Minister for Health, the Leader of the Opposition now, at the end of 16 long years of Labor rule as it was then. At the time, 15 years and 9 months. After 15 years and 9 months, they reached a point where so degraded was the South Australian health system, where they felt with an election coming up they needed to say some things, and the member keeps returning to these matters. Now, the record for the Labor Party is clearly written for the people of South Australia in the situation that was confronting the people of South Australia in March 2018. Upon us coming to government, we have delivered since then dramatic improvements for the people of South Australia, for SA Health, which I've referred to in my earlier answer, which the Premier has referred to in his earlier answers, and for the members' benefit, the Hansard should be available on the current day's transcript any minute now.
Order. Before I call the member for Ghana. Order. Members on my right. Members on my left. Before I call the member for Ghana, I call to order and warn the member for Mawson, who is interjecting from a place other than in his seat. The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. What is the Premier's response to the account of frontline paramedic Jim Birchland, who has spoken publicly about being run off his feet with no ability to respond to an emergency? And with your leave, sir, and the House, I'll explain.
Leave is sought. Is leave granted? Leave is granted. The member for Ghana.
The Sunday before last, paramedic on the front line, Jim Birchland, bravely recounted his last shift, saying, and I quote, "I just went from job to job to job. Towards the very end of the night myself, my partner and then another ambulance crew were all too fatigued and short on equipment to attend a life-threatening case. I'm actually at risk of just crashing into a tree if I go."
The Premier.
Thank you very much, and I thank the member for his question. Look, we take these concerns extraordinarily seriously, and we thank our paramedics and those who work in the South Australian Ambulance Service for the outstanding job they do on behalf of the people of South Australia, sir. In response to questions that the member asked most recently regarding the net costs or the costs of the South Australian Ambulance Service, it was asserted that there was a reduction. I've just had a look at the budget paper, which is available to every single person here, and what we can actually see is not as suggested by the member, but in fact quite the opposite. If we look at the If we look at the budgeted for South Australian Ambulance Services
members on my right.
in 2019-20, the budget was $305 million, and then the expenses in 2020-21 actually go up from $305 million
The member
to
for Ghana.
$313. So
member
you see
for
there's
Hurdle Vale.
an increase in the expenses, and the member, I think, wants to, if you like, I don't want to assert improper motives, sir, but he was basically trying to look at the net cost, which included the income which comes in to the area. So I make the point that the expenses, the amount of money which is going in is actually significantly higher. I also, sir, took the opportunity to check the assertion that was made opposite regarding the number of nurses
Hurdle Vale is warned.
in the system as well between 17-18 budget and the 19-20 budget, sir. And in fact, I think members would be very interested to know that there was actually a 286 number increase in the number of nurses between those two areas as well. One of the great things about our our parliament is that you can go and check the budget. They're all just in the area out behind here, and as I said, the budget for expenses within the South Australian Ambulance Service has actually increased from the 19-20 year through to the 2021 year by around $8 million.
Before I call the member for Schubert, I call to order the member for Ghana. I warn the member for Hammond, and I call to order the Minister for Infrastructure and Transport. The member for Schubert.
Thank you, Mr Speaker. My question is to the Minister for Primary Industries and Regional Development. Can the Minister update the House on how the government is securing business and consumer confidence through investigating greater water security for the Barossa wine industry?
The Minister for Primary Industries and Regional Development.
Thank you, Mr Speaker. I thank the member for Schubert for this important question. It was great to be up in his electorate last week just as harvest starts in that area as well, to see the confidence from the grape and wine industries up there as they head into what they believe is going to be a wonderful vintage. The importance of this region is paramount to this state. It's very important that we understand the importance of the water supply in particular into this region. And as we see the challenges that some, particularly the Eden Valley, is facing through the lack of water availability, it's important we investigate into this space. So we've very much seen as one of the key things on the list of 6 infrastructure projects. One of them is looking at getting water into this Barossa Eden Valley region, and it's important that we continue to work on that. And we've been up working on this project, and very much supported by the member for Schubert in this project, working with the Barossa Grape and Wine Association as well as the Barossa Infrastructure Limited to actually try and achieve an outcome for this region. This initiative is so important. It not only creates jobs, but it's also about making sure we grow this sector. To capture and treat effluent water and turn that into effective water available for grape growers in this region is an important initiative that will give them security beyond the vagaries of weather. The security to these growers will enable them just to not only get their existing plantings producing well, but will also give the ability for future plantings. This will lead to significant expansion in that region of potential growth of up to nearly $300 million is the estimates that will return from this investment into a pipeline of taking effluent into that region. And that will also lead to 1,000 new jobs in this region. Not only is this important for the region itself, it's important for the state and important for us nationally as well. And it's really important to understand that the state government has applied to the federal government to partner in this going forward. We have made an application to put some funding on the table to make sure that we get a secure business case to be able to put this project together, and made an application going forward to the Morrison government's National Water Infrastructure Development Fund. It's important that we get this work done to make sure that we are able to design the appropriate project going forward, to make sure that we're able to deliver for that community, make sure that there is the opportunity for the investment that's required to return for our state. This is a key part of the growth initiatives of this sector, to make sure that they're able to deliver for us so that we can deliver a $23 billion target by 2030 for the ag sector into this state. It's important that we continue to work with this group, and I thank the member for Schubert for his advocacy in this space. This is a very important project for South Australia. Very much recognise the fact it's now on the infrastructure list, and this project needs to be delivered.
The member for Ghana.
Thank you very much, Mr Speaker. My question is to the Premier. How does the Premier respond to frontline paramedic Josh Cox's desperate plea for additional resourcing to prevent a catastrophe? And with your leave, sir, and the other House, I'll explain.
Leave is sought. Is leave granted? Leave's granted. The member for Ghana.
Last Monday, frontline paramedic Josh Cox courageously fronted the media saying, quote, "People need to know that the community is at risk. We're one large-scale motor vehicle accident away from a catastrophic event. I firmly believe that."
The Minister for Education.
Sir, I thank the member for the question. The government is very committed to supporting its community through enhanced ambulance services, through enhanced health services, and indeed anyone working in that system. We are working day and night to see the system be the best it can be. But the member in his question talks about lower resourcing, and as the Premier clearly outlined in his last answer, and as clearly outlined in the budget papers, the member misrepresents the facts if he says that there indeed is less expenditure on this service. This government continues to support enhanced services, and I do encourage the member for Ghana to read carefully the advice provided in my earlier answers and the earlier answers from the Premier.
The member for Gunner.
Thank you. My question is to the Premier. Why has the government still not publicly released a report they commissioned over 2 years ago from ORH, or Operational Research in Health, regarding what resources are needed in the SA Ambulance Service?
The Minister for Education.
Thank the member for the question. As the Minister responsible for the Minister for Health in this chamber, I will seek a response to that question from the Minister for Health and bring back an answer to the House.
The member for Elizabeth.
Thank you, sir. My question is to the Minister for Emergency Services. Minister, are all members of Parliament able to hold community forums at metropolitan fire stations? And with your leave and that of the House, sir, I'll explain.
Leave is sought. Is leave granted?
Sir,
leave is granted. The member for Elizabeth.
Sorry?
The member for Elizabeth.
Yes, the member for King held a crime forum at the Salisbury MFS Command Fire Station on Saturday the 27th of February and will hold another forum on the 9th of March. Will the same access to MFS fire stations be made available to all other members of Parliament?
The Minister for Emergency Services.
I thank the member for Elizabeth for the question. The member for Elizabeth will note that I believe in recent times, I think the member for Mawson held a community forum. I believe there was a member of SAPOL that was present at that forum.
Order. The Minister has the call.
So as I was saying, Mr Speaker, I think the member for Mawson just held a community forum recently, and there was a member of SAPOL there. I certainly didn't have a problem with that, sir. I think it was a community forum. What I couldn't understand, sir...
Order, members on my left.
What I couldn't understand is, given how long he'd been in Parliament, sir, when you took the Labor hacks that were there in the room, why he could only get 30 people at the forum. That's what I couldn't understand, personally. But...
Order.
But from time to time, sir,
members on my right.
Myself as Minister, I will get asked lots.
The Minister will order. Members on my left. The Minister will not respond.
I'm sure you sent a few as well.
The Minister will not respond to interjection. The Minister has the call. He's entitled to be heard in silence. The Minister.
So from time to time, my ministerial office might get asked if there are community forums in a member's electorate. I will certainly consider those, and if I think it's beneficial to the local community at the time, then it's not unusual, sir, for a member of SAPOL, for example, to be present, like at the member for Mawson's forum, or at the member for King's. Or in the member for King's electorate, sir. And for all I know, sir, there might even be other requests that are made from independents or other members of the House, sir, and myself as Minister will certainly consider those, consider any protocols that exist. I'm certainly not going to have a... You know, I know that the Minister... I know that the member for... I know that the member for Elizabeth, for example, has attended stations from time to time, and I know that certainly exists. But I think I've reiterated to the House, sir, from time to time, these requests are made and they're considered on a case-by-case basis.
Order. Before I call the member for Elizabeth, I call to order the member for Schubert. I warn for a second time the member for Chaffey. I warn for a second time the member for Cheltenham. Warn for a second time the member for Hurdle Vale. I call to order the member for Wright. Member for Elizabeth.
Thank you, sir. My question is again to the Minister for Emergency Services. Who approved the use of the Salisbury Command Fire Station to host the member for King's Crime Forum?
The Minister for Emergency Services.
I thank the member for Elizabeth for the question. Look, I understand, sir, that the member may have arranged that by booking what is otherwise a publicly available room. I know that particular station is a very good station, and I know from time to time that there are requests made by members of community to hire that room.
Order. Order. Members on my right and members on my left, interjections will cease. Order. The Deputy Premier's call to order. Member for Hammond.
Thank you, Mr Speaker. My question Thank you. My question is to the Minister for Energy and Mining. Can the Minister update the House on recent results from the Fraser Institute annual survey of mining companies?
Minister for Energy and Mining.
Thank you, sir. And I thank the member for Hammond for the question. And yes, I can. Yes, I can. We've heard a lot today about the confidence that South Australian community has in our government. But, Mr Speaker, the Fraser Institute is a very, very important survey that they put out. The annual Fraser Institute survey assesses how mineral endowment and public policy factors affect mineral exploration and investment across the globe. It's a key tool used by the international resources industry to identify prospective jurisdictions and decide where they direct exploration investment. And, Mr Speaker, that's incredibly important because it goes directly to jobs, to employment, and much of that in regional areas, Mr Speaker. I'm pleased to report to the House that of the 77 jurisdictions ranked in 2020, South Australia has once again scored in the top 10 jurisdictions globally. South Australia ranked 8th globally in the Best Practices Mineral Potential Index, a great result. This signals to the international exploration community that SA is a strong place to do business. It means that we are predictable and methodical and reliable. It means that we don't pull surprises on our biggest growth sector without meaningful consultation and engagement first. Importantly, South Australia ranks 6th in political stability, up from 18th in 2019. That's despite the efforts of the Labor opposition trying to turn our biggest growth industry into its own political plaything, Mr Speaker. The report shows the Marshall government's improvements to the Mining Act and programs are amongst the best in the world. Our reforms to the Mining Act have provided greater protections for landholders, improved buffer zones, more time and financial support, access to free advice and new protections for farm biosecurity, Mr Speaker. Also, new programs like this Accelerated Discovery Initiative, which is helping seeing explorers test new concept and exploration plays in SA, looking at the next big projects. Explore SA, the Gawler Challenge, Phase 1, a world-first initiative bringing together geologists, mathematicians and data scientists to find new deposits. Explore SA, the Gawler Challenge Phase 2, which is seeking to advance these towards being drilling prospects, Mr Speaker. Core Innovation, bringing together start-up hubs and high-tech industries to advance the sector. The 2020 survey shows that despite the stunts of SA Labor, we've been getting on with the job of governing the state, Mr Speaker. The 2020 survey has indicated that South Australia is one of the leading jurisdictions at the cutting edge of thinking and policy around resource development, Mr Speaker. The Leader of the Opposition should be ashamed of what his team is doing in this chamber, trying to make this industry just a political plaything of their own.
Order. The member for West Torrens rises on a point of order.
Well, debate, sir, and a reflection of the vote of the House.
I'll take on board the first part of the point of order, which goes to Standing Order 98. I'm not so sure there's any point of order in relation to the second limb. I'm conscious of the question. I draw the minister's attention to the question, which is quite specific, and referred to the results of the Fraser Institute assessment. And the minister is addressing that. The minister has the call. Minister.
Thank you very much, Mr Speaker. We're proud of the Fraser Institute's assessment of South Australia. We accept that this is an achievement of the industry with the support of our government, despite what the opposition is trying to do to play political games with this industry. Mr Speaker.
Order. The member for West Torrens rises on a point of order. The minister resume his seat.
Standing Order 98, sir. The minister is implying a course of action by the opposition to make an argument. That is debate, sir, and it is inappropriate in answering a question.
In relation to the point of order, the minister is entitled to draw from the results of what I understand to be a Fraser Institute assessment, and in doing so to put those results into some sort of context. I have the point of order as to debate. The Minister will be responsive to the question. The Minister has the call. The Minister.
Thank you very much, Speaker. Imagine how much better these results would be if we had bipartisan support for this industry across South Australia, Mr Speaker.
Order. Order. The member for West Torrens on a point of order.
That is clearly now debate, sir. Implying motive again on the opposition, sir, is debate.
I uphold the point of order. Insofar as the Minister departs from observations in relation to the Fraser Institute's assessment and makes broader observations as to an ideal world, the Minister might have departed perhaps too far into an area which might contravene Standing Order 98. So I uphold the point of order. The Minister has the call. The Minister.
Speaker, imagine how much better these results would be if things were different, and Mr Speaker, we know exactly what we need to have changed. We are focused on making sure that our largest sector in South Australia, the agriculture sector, continues to thrive. We are focused on making sure that our largest growth sector in South Australia, the resources sector, continues to thrive, Mr Speaker. We are putting policies in place, we're putting legislation in place, we're putting regulations in place. Despite the best efforts of those opposite, we are continuing down this path because it's what's best for South Australia, creating jobs, creating exports, creating secondary and third-tier industries that support these important sectors. Mr Speaker, the Fraser Institute recognises the good work that we are doing in South Australia. Yeah.
The member for Mount Gambier.
Thank you, Mr Speaker. My question is to the Minister representing the Minister for Health. Can the Minister explain to the House when the COVID vaccine will roll out in my electorate of Mount Gambier?
The Minister for Education.
Thank the member for the question. The state government is working very closely with, of course, the federal government, who are, of course, the prime mover in this matter. They have purchased the vaccine, and indeed, along with all other states and territories, we are working on that rollout. Now, in relation to what specific dates there may be that are relevant to Mount Gambier, I will seek information from the Minister for Health and bring back a response to the House.
Yeah.
To the Minister.
The member for Frome.
Yes, thank you. A supplementary. When you're talking about the member for Mount Gambier, can you bring that the timetable, and for the whole of regional South Australia? Because it's not only, and the member for Mount Gambier has got the question I was going to ask also, but can you do that for the whole of regional South Australia, please?
Order. The Premier.
His question regarding the vaccine rollout in South Australia. Professor Brendan Murphy, who was the Chief Medical Officer, he's now the Department Secretary for the Commonwealth Department of Health, has described this exercise as the largest peacetime logistical exercise in the history of Australia, and I think he's right. There is a combination. There's a combination. Most people are quite interested in the vaccine rollout. It's this is a massive logistical exercise for our country. A lot of thought has gone into and continues to go into this rollout. The Commonwealth is, of course, responsible for the TGA approval for the vaccines, and so far we have the Pfizer vaccine and the AstraZeneca vaccine, which are approved. They are also responsible for the procurement of those vaccines, and we have now seen the Pfizer arrive in Australia and the AstraZeneca arrive in Australia. In fact, we could be getting our shipments of the AstraZeneca vaccine later this week, and that will really significantly reduce some of the complexity of the rollout of the vaccine, because it doesn't have the same cold chain logistics requirements of the Pfizer vaccine, which is problematic in regional South Australia, because you need to keep that cold chain in place at -70 degrees. So the AstraZeneca, which is very similar to the existing types of vaccines and shots used right across regional South Australia, and can be just maintained at below 5 degrees, which will make life a lot easier. We're doing well in terms of the rollout of phase 1A, which is really those people who are on the front line. People that have been in a situation where they could definitely come into contact with somebody who has the disease, so people in our medi-hotels, people in the airports, people on the borders. And then, of course, we move through in a graduated way through different risk categories, starting with older South Australians, people that have got other pre-existing conditions that make them a priority for us. We're going to be rolling this out for the remainder of the year. It is a combined effort with the federal government responsible for aged care facilities, disability facilities here in South Australia, and then a joint responsibility in terms of the general vaccination, where we will be doing some within our hospitals and clinics, and the federal government responsible for the vaccinations through the GP networks and also through pharmacies. The final detail of those arrangements is still being worked through. There's a sort of, if you like, a co-commissioning arrangement between the federal government and the state government to make sure that we've got good geographical coverage in South Australia. We don't want to have just a sort of a single number, but having them all concentrated around one area. This is a big logistical exercise, and so details of that are being worked through at the moment. We have a National Cabinet meeting again this Friday. I will, of course, be attending that, and I'm quite sure that as we get to that meeting and then beyond that meeting, there'll be far greater detail. It is a big task. It's a task that Nicola Spurrier, Chris McGowan and their team has been working on since last year. I know that we have all been very proud that in South Australia we've had amongst the highest testing rates in the world, and I'm quite sure that we will also ultimately have the best vaccination rates in the world as it rolls out.
Member for Frome.
Thank you, Mr Speaker. My question is for the Minister for Transport and Infrastructure. Can the Minister advise to update the House on the total funds allocated to the Horrocks Highway in light of the media statement made by the Deputy Prime Minister, Mr Michael McCormack, last Saturday? And with your leave, Mr Speaker, I'll enhance a bit further.
Leave is sought. Is leave granted? Leave's granted. The member for Frome.
Thank you. Last Saturday, there was a media conference from the Deputy Prime Minister of a $100 million boost for regional South Australian roads. I've had several requests regarding the statement made by the Deputy Prime Minister. Now, was this? They want to know, what was this statement? Was that an extra $100 million, or does that already include the 19.9, which included $19.9 million for the upgrade of the Horrocks Highway between Templars and Wilmington? Is the statement by the Deputy Prime Minister additional funds for that section of the Horrocks Highway, or is it funds being reallocated and re-announced again?
The Minister for Infrastructure and Transport.
Thank you very much. I thank the member for his question and note that the work that has been happening in this space, I did outline some of the details a few moments ago, but there are two tranches of work here, the initial tranche which you talked about, and then the road safety tranche which came in the last budget. Look, that was a real great opportunity, as I mentioned before, to partner with the federal government, because we know road safety is vitally important, and especially across our regional roads. So the way that road safety funding was put forward, again with the federal government, it was an 80-20 split. So we put in $42 million, and the federal government put in their share. We ended up spending another 58 on metro roads as well. But just sticking to the regional roads and where then ended up, I think it was 210 in the end, 168 from the feds, 42 from us, and that's going to be done across three tranches. I mentioned before this was done in what the Deputy Prime Minister, when he put this proposal out, was described as a use it or lose it a scheme, and it was being done in three tranches across the next 3 months. We sent the department away to look at what projects we could get moving very, very quickly, and some more work on the Horrocks Highway was outlined in that, along with a number of other regional roads, again, because we know that for 16 long years they were neglected and not looked after. So that's happening, and it's happening in the three tranches. One of the great things, again, that the department did incredibly well, and I thank everyone for their tireless work on this, was they had projects that were ready to go, and we were able to get them out. So we put our applications into the federal government as that asked through the process, and our tranche of works were the first ones put in. Other states were actually slow to get moving, and they were slow to get theirs in. That's all in the hope that if they don't use it, they'll lose it, and we can perhaps put some more offerings in. So we're watching that really closely. But the great thing was our first tranche, the $100 million, was accepted by the federal government, and work is starting on that right now. The next tranche will come along, and again we've got those bodies of work in train as well, and we'll look at that through tranche 2, and then some more work through tranche 3. What we know with road safety as well, and a lot of the works, in fact, I was actually up on the Horrocks Highway just the other week. I drove up, went up through Clare. From Clare, we went on to Crystal Brook and saw the great work that's happening at the footy club there. Then we went on to Melrose and up to Port Augusta, and then came back through Port Pirie on the way home. So it was a really good drive to have a look at a lot of those roads. And the work that's already rolling out on the Horrocks Highway is fantastic. That shoulder widening, we know that makes our roads safer. Of course, we have the audio-tactile line marking, and then where it's needed, we can put the barriers in place. So again, to the question, there was a body of work that was happening. We identified that needed to happen, as you outlined, and then the extra work that came along, the extra funding that's come along, is for those road safety mechanisms. So once again, we're really keen to partner with the federal government on this. We know our regional roads right across the board, whether it's going north down into the south-east, across to the Eyre Peninsula as well, anywhere we can look to do these bodies of work to increase the safety. And that's become more prevalent, I think, through COVID. A lot of people are travelling around South Australia, and more than ever I'm hearing reports from people from the city that have actually been out holidaying and spending their time in the regions talking about our country roads. In the past, it would only be country people that would really see them and know them. You should sort of go for a drive out and have a look at some stage. It's worthwhile doing. And people have noted that that's what we need to be doing in our state. So it's great to be investing in that. Again, I talked about the neglect before and the road maintenance budget that grew up to $750 million under the previous Labor government. We're chipping away at that, and we know more work needs to be done. So when that opportunity came from the federal government, we were really clear that at the 80-20 offering, we could get $210 million for the regions, and then we put 58 into Metro. So don't tell my Metro friends about that, because they'll be disappointed that the regions got so much. But we were really conscious of what needed to happen there, because they needed that help and that support. So it was a really great result, and we're really happy with what's happening, and I think the people in your region will be ecstatic with the end results as well.
Order. The time for answering the questions expired. The member for Waite.
Thank you, sir. My question is to the Minister for Education. Can the Minister please provide an update to the House on the rollout of the Public Schools Sanitary Products Program and how this will benefit my community of Waite?
The Minister for Education.
Look, I thank the member for the question. This is an important opportunity, I think, to talk about this valuable program, which was trialled across a number of schools, I think 25 from memory last year in the public education system. Of course, most, if not all, schools with girls and young women who most or if not all schools with girls or young women from about year 5 up, so that's all of our secondary schools, and indeed the overwhelming majority of our primary and after 12 schools, had some sort of process in place previously. And this was identified by the Children's Commissioner in her 2019 report on a range of matters, but one of the things that she identified at that time was brought to her attention was those schools who may have had the process, or some may not have, but those schools in particular that may have had a process where products could be supplied upon request if there was an emergency, or if indeed there was a student whose family, for whatever reason, was not helping that student have the product that they needed. It wasn't necessarily always done in the most dignified manner, or the manner that was most suitable for that student. Some students identified indeed that they didn't want to go to school if they thought they were going to have to ask a teacher or ask a receptionist, or indeed put it to the staff at the school in an environment where others might be talking about it, and that their own personal lack of having tampons or pads might be brought to people's attentions. The Children's Commissioner, it may have been described in this way earlier, but the Children's Commissioner described it particularly as period poverty. And indeed, in this Parliament, we've had discussions about this matter over the last year and a half. At the beginning of last year, I worked with the Education Department to seek to improve the opportunities around South Australia, but we needed to understand what indeed was the missing link, because indeed at some schools they were identifying, the teachers and the principals were identifying that they felt like they were offering a sufficient arrangement. Indeed, many of our schools already engage with local shops who provide product free of charge. Some of our schools engage with non-government organisations, charities, who supported those schools. A couple of our schools were trialling vending machines, for example, where students may be able to attend that vending machine and get the product. But some of the feedback came that those even weren't necessarily appropriate either, because if they were in a public communal space, potentially in the reception area at a school, if a student had to go there to get the product from a vending machine, then that might not be what was their preferred way of doing it. Vending machines, of course, are also expensive, thousands of dollars, and have a maintenance cost that then has to be borne by the school as well. What a lot of the schools provided to us in feedback was, when we did this trial, in particular, we encouraged them to talk to their student bodies. And I think is one of the most important parts that is now rolling out across South Australia in the work that we're doing. Schools are being asked to take the resources they currently have, supplemented by a modest grant from government to enable them to have a trigger to ensure that they can access extra supplies if needed, and have a conversation with their students. Many of them indeed now have committees, social action committees or girls' committees or young women's committees or whatever the situation is, SRCs, resupplying stock in bathrooms, which is often the safest and most dignified place to get it. But the key thing is the school needs to have that discussion with their students. We'll supplement them with a modest grant, and we'll be doing a survey of all of our schools in Term 3 to identify how those conversations have gone, what extra supports have been provided, whether schools do indeed have all the support they need, and indeed if there are refinements to the policy, then we'll be rolling them out before the end of the year. This has been welcomed by schools, by students, by the non-government organisations, and indeed by the whole community, and I'm proud to be part of a government that is delivering for girls and young women, indeed all students in South Australia.
Order.